The House will come to order. Messages from the Senate.
Message from the Senate. I hereby announce the passage of the following Senate files herewith transmitted. Senate file numbers 359, 1694, and 1598. Message is signed Cal R. Ludeman, Secretary of the Senate. Is there a first reading sheet for these? It's going to come down. It's not down there?
What is it?
I'll try to wing it. You got one?
Is it for this one, first reading of the Senate? That's okay.
No, that's not. But is it helpful for you to just wing it off?
Okay, I'll wing it somehow here.
First reading of Senate files.
Here it comes. I knew it was coming.
First reading of Senate files, Senate file number 359, an act relating to human services. Baker moved that Senate file number 359 and House file number 696, now on the general register, be referred to the Chief Clerk for comparison.
Hearing no objection, so ordered.
First reading Senate file number 1598, an act relating to family law. The bill is being referred to the Committee on Public Safety and Security Policy and Finance. First reading Senate file number 1694, an act relating to the military. The bill is being referred to the Committee on State Government Finance. That's it.
Calendar for the day. The first bill on the calendar for the day is Senate File 482. The clerk will report the bill.
Senate file number 482, number 1 on the calendar for the day, an act relating to health licensing, the second engrossment.
I recognize the member from Dakota, Representative Peterson, to introduce your bill.
Thank you, Mr. Speaker. The Board of Medical Practice protects public health by assuring that people who practice medicine are competent, ethical, knowledgeable, and skilled. This bill provides some title protection as well as defines ethical behavior and also provides grounds for discipline. After working with numerous stakeholders, we found some language that everyone could agree to, and I would ask for your support for this bipartisan bill, and I'll stand for any questions. Thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate file number 482.
Third reading. The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Would Representative Peterson yield, please?
She will yield. Representative Liebling.
Thank you, Mr. Speaker. Representative Peterson, I'm just looking at the bill here, and I just want to be clear. Are we taking up this? We have the Senate language before us? She's nodding yes. And so my question is about the Senate language, because, of course, there's a piece in here that wasn't heard in the House. And that has to do with, it's on line 2.18, it begins, and it talks about nothing in the section shall be construed to prohibit a healthcare professional from using a title incorporating any of the words specified in paragraph A. So my question to you is, the words specified in paragraph A that are otherwise protected in the bill are words like, terms like medical doctor, doctor of medicine, osteopathic physician, things like that, things that we recognize as having a certain meaning, and it makes a lot of sense to protect those titles. But that second part that came from the Senate seems to allow those to be incorporated into something else. So, for example, could somebody make up the term naturopathic medical doctor or naturopathic? And I don't want to pick on the naturopaths, but you know, you could pick up a number of things. Naturopathic doctor of osteopathic medicine or something like that. Is that allowed under the bill as it came from the Senate?
The member from Dakota, Representative Peterson.
Thank you, Mr. Speaker and Representative Liebling. The reason why that language was added was to actually satisfy the stakeholders, particularly from the podiatrist as well as the chiropractor. And there are specific titles that include physician in their language or using the word doctor. So that was to clarify and satisfy that, and that was okay with the Board of Medical Practice as well as with those other groups. And I did have discussions with those groups actually before it was, during the process of when it was being heard, but we couldn't come to an agreement on the exact language, and this is the language that they adopted in the Senate, and that's why we accepted it here.
The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Thank you, Representative Peterson. And I know that you're working on this to try to resolve a problem, so this isn't about you. But I understood what you just said to be that you didn't really get to so-called peace in the valley with the stakeholders except that the Senate sent it over. Maybe I misunderstood you. I mean, the fact that something came over from the Senate doesn't by itself satisfy me that it's the right thing for us to do. I hope you agree. So, maybe you could give us a little more understanding of this. If the stakeholders have assured you that they're okay with this provision, especially like the Minnesota Medical Association, I mean, the people whose titles would be surgeon, physician, osteopathic physician, and those kinds of names. I mean, I don't want somebody to call themselves a chiropractic MD. And I'm worried that this is what this allows. So could you please just clear that up for me, if she would yield?
She will yield. Representative Peterson.
Thank you, Mr. Speaker, and Representative Liebling. Yes, that's what the peace in the valley was, and this bill was passed in the other body a week or two ago. We were going to bring it here and actually adopt this language here instead, but since they adopted it over there, it seemed easier just to accept the language here. So that was between the Board of Medical Practice, the chiropractors, the podiatrists, and a plethora of other stakeholders, and that is peace in the valley language.
Representative Liebling.
Thank you, Mr. Speaker. Thank you, Representative Peterson. I'm just not clear, if she would yield one more time, Mr. Speaker. Is the Minnesota Medical Association okay with this?
Representative Peterson.
Thank you, Mr. Speaker, and Representative Liebling. If they're opposed to it, they have not informed me about that during the last several months that this bill has been out, including this language that has also been public for quite some time.
Further discussion to House File 482. Seeing none, the clerk will take the roll on the bill. Lesh votes aye. Clerk will close the roll. Mariani votes aye. There being 127 ayes and 0 nays, the bill is passed and its title agreed to. Next bill on the calendar for the day is Senate File 527. The clerk will report the bill.
Senate File number 527, number 2 on the calendar for the day, an act relating to health occupations.
I call upon the member from Goodhue, Representative Haley, to introduce her bill.
Thank you, Mr. Speaker and members. Senate File 527 and the companion House File 733 clarifies the Nurse Practice Act that was passed in 2014 regarding advanced practice registered nurses. APRNs include clinical nurse specialists, nurse anesthetists, nurse midwives, and nurse practitioners. This bill does not change the scope of practice at all. It doesn't have a fiscal impact. It only accomplishes some changes which are technical and operational. The most significant one is that an advanced practice nurse that has the degree from another state can practice in Minnesota, provided that they meet our requirements. The biggest one being having completed 2,080 required hours of postgraduate practice with a collaborative agreement with a licensed physician. This bill is bipartisan support, and I encourage a green vote.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File Number 527.
Third reading. Discussion to the bill. Seeing none, the clerk will take the roll on the bill. Clerk will close the roll. There being 127 ayes and 0 nays, the bill is passed and its title agreed to. Representative Clark, what purpose do you rise?
Point of personal privilege, Mr.
State your
Speaker.
point of personal privilege.
Mr. Speaker and members, I'd like you to listen as I and the other nurses who are in this body share with you the proclamation that the governor made for Minnesota Nurses Week, which is this week. And I would ask you to just be able to listen to it. And are you having trouble hearing me? Okay. Is that better? All right. I'd like you to listen to this, and we just had a couple bills that deal with nurses, so it's very, very appropriate. Mr. Chairman, Mr. Speaker and members, I'm going to start by reading this proclamation, and I'll just preface it by saying each of us who are going to talk to you have served as nurses. I myself was a public health nurse and an OBGYN nurse practitioner for many years before we came to the legislature, and so I'm proud to read this. Whereas the state of Minnesota places a high priority on high-quality health care and greatly appreciates the 128,761 dedicated and professional licensed nurses in the state. And therefore, I yield to Representative Erin Murphy.
Thank you, Mr. Speaker and members. Whereas the mission of the Minnesota Nurses Association effectively is to promote the professional, economic, and personal well-being of nurses, and whereas the MNA upholds and advances excellence, integrity, and autonomy in the practice of nursing and advocates for high-quality care that is accessible and affordable for patients and consumers, and I yield to Representative Hertaus.
The member from Hennepin, Representative Hertaus.
Well, thank you, Mr. Speaker and members. And whereas registered nurses strive to meet the different and emerging needs of Minnesota in a wide range of settings, including medical centers, local hospitals, outpatient clinics, psychiatric centers, nursing homes, veteran homes, addiction treatment centers, correctional facilities, medical rehab facilities, homes for the developmentally disabled, adolescent residential and secure facilities, community facilities, schools, and private offices, and even that occasional knock on your own home door, I yield to Representative Lori Halverson.
The member from Dakota, Representative Halverson.
Whereas the cost-effective and high-quality health care services provided by registered nurses continues to be an important component of Minnesota's health care delivery system, and more qualified registered nurses will be needed to meet the renewed emphasis on primary and preventative health care and the increasingly complex needs of consumers. And I yield back to Representative Clark.
The member from Hennepin, Representative Clark.
Thank you, Mr. Speaker. Whereas the Minnesota Nurses Association has declared the week of May 6 to 12, 2017 as Nurses Week to coincide with the anniversary of the birth of Florence Nightingale, the founder of modern nursing. I'm just going to pause there to say, in my nursing education, I learned how Florence Nightingale, during the Crimean War, one of the main things she did was go into the military hospitals and throw open the windows to let in clean air. It's amazing what we've learned since then. Now, therefore, I, Mark Dayton, Governor of Minnesota, do hereby proclaim the week of May 6 to 12, 2017 as Minnesota Nurses Week, and it's signed by Governor Dayton. Thank you, members.
Member from Carver, Representative Nash. What purpose do you rise?
Thank you, Mr. Speaker. Point of personal privilege.
State your point of personal privilege.
Mr. Speaker, earlier in the day we were joined by members of ABATE Minnesota, and for all of you who ride motorcycles, you know who they are. They are an advocacy group who promotes education, safety training, and greater awareness for all drivers to see motorcycles better. And I have a proclamation here today to honor their volunteerism for our state. And one quick story as to why I'm doing this. One of my constituents was involved in a motorcycle accident where the person who hit her didn't see her. And for those of you in transportation for the last 3 years, you know that is why I brought my Start Seeing Motorcycles bill. And I am very hopeful that that will survive all the way through the end to the governor's signature to help promote motorcycle safety. But I will read the House resolution. A House resolution recognizing the month of May as Motorcycle Safety Awareness Month. Whereas the motorcycle is a popular means of transportation for commuting, touring, and recreational use, and whereas there is a growing need for cooperation among automobile drivers, motorcyclists, bicyclists, and pedestrians to reduce injuries and fatalities when using our streets and highways, and whereas it is beneficial for all Minnesotans to improve their knowledge of roadway laws, and whereas Motorcycle Safety Awareness Month calls attention to the importance of actively promoting safe motorcycle operation, increased rider training, improved licensing efforts, and better motorcycle awareness. And whereas by improving our collective understanding of the needs and responsibilities of all road and highway users, by encouraging the exercise of added caution, we make our roads safer for everyone to enable motorcyclists throughout the state of Minnesota to have an enjoyable riding season. Now, therefore, be it resolved by the Committee of Rules and Legislative Administration that the House of Representatives of the state of Minnesota that it recognizes the month of May as Motorcycle Safety Awareness Month and extends our best wishes to motorcyclists across the state. Signed, Kurt L. Doubt, Speaker, Joyce Pepin, and myself, Jim Nash, State Representative. Members, please be very mindful of Motorcycle Awareness Month. Thank you.
Next bill on the calendar for the day is Senate File 1353. The clerk will report the bill.
Senate File number 1353, number 3 on the calendar for the day, an act relating to health occupations, the first engrossment.
I call upon the member from Sherburne, Representative Zerwas, to introduce the bill.
Thank you, Mr. Speaker. Members, this bill defines the term telemedicine under Chapter 147 and makes clear the same standards apply to both the in-person practice of medicine and the practice of telemedicine under the Minnesota Practices Medical Practices Act, although the definition of telemedicine in statute for purpose of reimbursement by medical assistance or other insurance, there is no definition outside of that area, and so this bill helps clarify that.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File Number 1353.
Third reading. Discussion to the bill. Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Would Representative Zerwas yield to question?
He will yield. Representative Liebling.
Thank you, Mr. Speaker. Representative Zerwas, I just want to be sure that we're all clear about what the bill does. There's a little, I think, ambiguity possibly in the language about whether phone calls are covered under telemedicine, and I'm talking about a phone call between a provider and a patient. And the language is just a little odd on line 1.13. Telemedicine may be provided by means of a real-time, two-way interactive audio, comma, and visual communications, comma, including the application, et cetera, et cetera. So I just want us to be really clear here on the House floor about whether or not a phone call would be included or could be included.
Representative Zerwas.
Thank you, Mr. Speaker, members. Excellent question, and you're right. We had a comma that delineates audio. So it can be audio, it can be audio video, or it can be just video. And so that would define telemedicine in the statute moving forward.
Further discussion? Seeing none, the clerk will take the roll on the bill. Nelson votes aye. Bernardi votes aye. Hillstrom votes aye. Lesh votes aye. Backer votes aye. Doubt votes aye. I'm supposed to put his button. His button? This button? It doesn't work. His button.
There you go. You can talk.
Clerk will close the roll. There being 127 ayes and 0 nays, the bill is passed and its title agreed to. Next bill on the calendar today is Senate File 1844. Clerk will report the bill.
Senate File Number 1844, number 4 on the calendar for the day, an act relating to Health and Human Services, the first engrossment.
I call upon the gentleman from Sherburne, Representative Zerwas and company.
This seemed like a good idea at the time. Mr. Speaker, members, Senate File 1844 is an APRN Physician Assistant Signature Act. Right now, there are a lot of documents that outdated statute calls for a physician signature when an advanced practice nurse or a physician assistant can sign the documentation as well. We took the Senate language, which allows for an APRN or a physician assistant to, under an emergency situation, renew an eyeglass subscription. So that'd be the only difference between the House version and the Senate language that we took up.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File Number 844.
Third reading. Discussion to the bill. Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And Representative Zerwas, I know you're just holding your son, so I'll go easy on you. Right? Okay. Well, I'd like him to see if he would yield to a question, Mr. Speaker.
He will yield. Representative Liebling.
Thank you, Mr. Speaker. Representative Zerwas, the one thing, I think the bill's fine. I mean, this is, I think, mostly clean up and what we intended. But the one thing that I just wonder about a little bit is the issue about being able to sign a death certificate. And my question about it, I see the way it's written in the bill is just is a rule change, and I assume that this will get looked at again because of that. But I just wonder, do you know whether APRNs and physician assistants have training on determining cause of death?
Representative Zerwas.
Mr. Speaker, members, that specifically I do not know, Representative Liebling. I know I haven't heard from anyone opposing that, and I haven't heard from the MMA that had concerns with that language. The only concerns that I've heard at all about this bill was from optometrists around the language with the eyeglass prescriptions. But once it was described how narrowly that it needs to be in an emergent situation for that, that's the only feedback I've received on the bill this session. Representative
Liebling.
Thank you, Mr. Speaker. Thank you, Representative Zerwas. You know, I haven't really heard any concerns about it either, and that's why I'm going to support the bill. But I just wanted to flag that. I think, you know, for APRNs and physician assistants to do the stuff they're trained to do, I think most of what's in here, all of it probably is just fine with regard to that. And I think the bill, you know, it makes things more efficient, so you don't have to go off and find a physician to just, you know, put the stamp on something where the person is perfectly able to do that. But I just would like to flag this about determining cause of death, because I'm not aware that these practitioners have any training in that. I think pretty sure physicians do. And that's something that, so I see it'll get taken care of probably in the rulemaking process, but I just kind of want to flag that. And then I assume that the eyeglass piece that came over from the Senate, I assume that's already something that physicians can do. You're nodding yes, so okay. Appreciate that, and I'm going to support the bill. Thanks.
Representative Zerwas.
Thank you, Mr. Speaker and members. And Representative Liebling, I expect with the rulemaking, it would flesh out the piece about the death certificate. And yes, in statute, currently, physicians are allowed in emergency situations to issue replacement eyeglass prescriptions, not new prescriptions, not change someone's prescription, but to issue replacement prescriptions in an emergent situation. You can't blame me for trying the baby trick. It didn't work, but you can't blame me for trying.
Further discussion of Senate File 1844. Seeing none, the clerk will take the roll on the bill. David, where do you want? Clerk will close the roll. There being 129 ayes and 0 nays, the bill is passed and its title agreed to. Reports from the Committee on Rules and Legislative Administration.
Pepin from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Monday, May 15, 2017, and establishes a pre-filing requirement for amendments offered to the following bills. House File numbers 179, 1265, and 2621, and Senate File numbers 444 and 1457.
Announcements by the Speaker.
Announcement by the Speaker, a message from the Senate has been received requesting concurrence by the House to amendments adopted by the Senate to the following House File. House File number 1702. Okay. Okay. Announcement by the Speaker, a message from the Senate has been received requesting concurrence by the House to amendments adopted by the Senate to the following House File. House File number 2174.
Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there are no objections, we will take action on those motions first. Hearing no objection, the motions prevail. Announcements. Conference Committee report.
Conference Committee report, and this is the David's motion. Conference Committee report on House File number 676, an act relating to commerce. The report is addressed to the Honorable Kurt L. Doudt, Speaker of the House, and the Honorable Michelle L. Fischbach, President of the Senate. We, the undersigned conferees for House File number 676, report that we have agreed upon the items in dispute and recommend as follows. The Conference Committee report is signed by all three conferees on behalf of the House and all three conferees on the part of the Senate. Davids moves that the report of the Conference Committee on House File number 676 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the author, Representative Davids, who will explain the report.
Thank you, Mr. Speaker and members. House File 676 conference report has to do with pesticide applicators. The Senate put quite an amendment that greatly expanded the scope of the bill. That's not on here. It's the House language, except on line 2.1, it says must provide annual written notice to the customer. That was Senate language that we added in that helps clarify the bill. So I'd really appreciate your support, members.
Discussion to the Conference Committee report. Member from Hennepin, Representative Rosenthal.
Thank you, Mr. Speaker, members. This is a good bill. The Senate did load it up with lots of other contracts that may be good or not, but we could not vet them, so I urge a green vote.
Further discussion.
David's motion to adopt the Conference Committee.
We are on the motion, David's motion to adopt the conference report for House File 676. Seeing none, all those in favor of the adoption of the Conference Committee report signify by saying aye. Aye. All opposed, no. Motion is adopted.
Third reading as amended. The clerk will give the bill its third reading.
Third reading as amended. The clerk will give the bill its third reading.
House File number 676, third reading as amended by conference.
Third reading. Discussion. Member from Dakota, Representative Hansen.
Thank you, Mr. Speaker. Would Representative Davids yield?
He will yield. Representative Hansen.
Thank you, Mr. Speaker. Representative Davids, I asked this question earlier when the bill went, and with the pesticide applications that are covered in this bill, are they the external to the buildings and not the internal pest control applications that would occur inside of homes, apartments, institutional or residential buildings.
The member from Fillmore, Representative Davids.
Thank you, Mr. Speaker. Representative Hansen, I believe that it is exterior. It has to do with the landscape applications. It refers to nothing in the interior.
Further discussion to the conference. Representative Davids.
Thank you, Mr. Speaker, members, and I would like to thank the House conferees, Chairman Hoppe and Representative Rosenthal for your work on this conference report.
Any further discussion? Hearing none, the clerk will take the roll. Clerk will close the roll. There being 129 ayes and 0 nays, the bill is repassed as amended by conference and its title agreed to. Announcements. The member from Hennepin, Majority Leader Pepin.
Thank you, Mr. Speaker. I move that when the House adjourns today, it adjourns until 10 a.m., Friday, May 12, 2017.
Representative Pepin moves that when the House does adjourn today, it adjourns until 10 a.m.,
Friday, May 12th.
May 12th, 2017. All those in favor signify by saying aye. All opposed, nay. Motions prevail. Representative Pepin.
I move that the House do now adjourn.
Representative Pepin moves to adjourn until Friday, May 12th at 10 a.m.